I think you all want to know what it's like to have to go through this, and Sheila Cobo, who's here, is going to talk to you as a heart attack survivor. So please come forward. Thank you very much for being here. You give the real face to this terrible epidemic.
Thank you for having me, Dr. Fielding. Good morning, everyone. My name is Sheila Cobo, and I am a working mother in the employee benefits industry. I'm an assistant vice president. I have 2 young children. One is going to be 2 next month, and the other child is 10. Was recently diagnosed with coronary artery disease that happened to be misdiagnosed numerous occasions, even when I delivered my daughter in the hospital. I was in critical condition. They couldn't figure out why, and they never placed any suspicion in their minds that it could potentially be my heart because of my age. I was only 34 years old when I delivered my daughter. I'm 36 now, and went through a lot in the hospital when I delivered my daughter. And about 8 months later, I woke up one morning and had severe chest pains. And my husband called the paramedics. They took me in, sent me home the next day, said I was fine. It wasn't until the point where I got so persistent and that I knew my own body so well to listen to myself that I just kept on going, and I got a second opinion. And it was at that point where I was diagnosed with coronary artery disease. I was sent to the hospital for an emergency angiogram. They found a 90% blockage in my artery. They stented it, so luckily I didn't have to go in for emergency bypass surgery or anything like that, for that matter. So thankfully I'm very lucky from that perspective. But I'm here to tell you today that it can happen to anyone, and heart disease does not have an age limit. It does not discriminate against race, age, or gender. And I'm here to tell you today that what I have done for my own self, I've gotten actively involved with the American Heart Association because I feel very passionate about this cause. But also I have done a lot to modify my risk factors, even though I already have a family history of heart disease. I've done a lot to modify my risk factors, such as eating a very healthy, low cholesterol diet. I've lost a significant amount of weight since my event happened, and I eat a very low sodium diet, and I take every opportunity I can just to get out there and walk and exercise. For example, Christine and I walked all the way from our office down on 7th down here this morning, and so we got our exercise in for the day. So I really appreciate the opportunity to be here to share a little bit of my story to you all. And like I said, you know, if you don't feel right, if you feel like something's going on inside of you and the doctors aren't listening to you, be persistent. Heart disease does not discriminate. Thank you for having me.
Thank you. Please stay here, and we'll open it for questions.
Okay.
Please, Mr. Lawrence, come forward as well. Any questions? Yes, please.
Dr. Fielding, is heart disease still the #1 disease?
Yes, in terms of overall mortality, heart disease is still #1 killer in Los Angeles County.
Even with this drop?
Even with the 41% drop, heart disease remains the #1 cause of mortality in Los Angeles County. And stroke remains a very high number as well, and even despite its 39% drop. So yes, we still have more work to do, a lot more work to do, but this is just an unprecedented reduction. I mean, imagine in 1 decade to have 41% decline. That's really incredible. And so we know that some of that is we're doing better in terms of medical care for those who have the disease, but we want to prevent people from getting the disease in the first place. And the biggest contributor to that right now has been the reduction in smoking. The fact that we have fewer cases is largely due to the reduction in smoking, maybe a little bit to slight increases in physical activity. But we still have a lot of risk factors, and we know our biggest epidemic right now is obesity and overweight, and we have to work on that because that increases your risk of high blood pressure, high cholesterol, diabetes, all of which in themselves are risk factors for cardiovascular disease. So we have a lot of work to do. This is a celebration because it's unprecedented and it's large, but it re-energizes us that we need to do more.
What sorts of public policy steps can be taken over the next 10 years to continue this decline?
Well, there's several public policy steps. One, of course, is public education about the warning signs of heart disease and stroke. But in terms of public policy, we need to think of how do we get people to be more active. So that means changing the built environment, having more mass transit, having more bikeable, walkable community streets where people can, in fact, walk to shop. They don't have to go around from cul-de-sac and drive around. People who live in the suburbs and spend a lot of time in cars are on average 6 or 7 pounds heavier just because they don't have as much opportunity to walk, and every place is going in the car. Making sure that, particularly in low-income communities, but in every community, that schools are open after school and on weekends for the whole community. Basically, many cases, that's the only parkland that's available, and particularly in areas with high cardiovascular disease, that's a problem. We also need to look at what people are eating. That's a critical issue. There's not enough access to fresh fruits and vegetables, particularly in a number of our low-income communities. We also we have a high density of fast food outlets, particularly around high schools, particularly, again, in low-income communities. We need those folks to step up and have healthier options, have smaller portions, reduce the fat, salt, and sugar in the things that they serve. And those are really important issues as well. Education, more physical activity in terms of school starting at the preschool. There has to be more physical activity, not just the PE that some of us had, which was not very active, but really active, letting people know that aerobic activity is really an important part of your normal life, and building physical activity into life is a normal part of that. And then for tobacco, increasing the policy options that local communities take advantage of. So, for example, we've reduced the access to minors by having cities have a separate license for those that sell tobacco products. And that's very important because that's unfortunately a good cash cow for those businesses, and they don't want to get that license taken away, and so they're much more careful not to sell to minors. And we want to make sure that there's smoke-free parks. We have smoke-free beaches. We want smoke-free parks. Smoke-free outdoor dining. A number of communities have decided on that because, again, secondhand smoke is a very serious problem. And then to look at the issue of housing, of rental housing, and oftentimes you can have somebody in an apartment next door to somebody with asthma, and that smoke that they may be smoking, and it comes right through the same HVAC system and affects the people that are in the next apartment. So focusing over time on smoke-free housing is going to be very important as well, and a number of communities have started that process. So those are at least some of the things that we need to do. But we also need to do a better job of controlling those risk factors. We need to do a better job of treating high blood pressure. There's still a lot of people that have it that aren't adequately controlled, some that don't know it, many that know it, but just, haven't, because it's silent, haven't gone back to the doctor, haven't been taking their pills, et cetera, et cetera. The same with high cholesterol. We have solutions for that, but not everybody has been taking their medicine, and we have to reduce the frequency of diabetes and the control of diabetes.
Even though the mortality rate has gone down, has the overall heart disease gone up?
Well, I don't think we don't have exactly those numbers. We assume that heart disease, that we don't have the new number of new cases. We think that that's probably gone down to some extent as well, primarily because of the reduction in tobacco use. But we don't have those specific numbers. But again, I'd point out that there's a 26% decline nationally, while we had a 41% decline in Los Angeles County for heart disease, and we had a 39% decline in stroke compared to a 34% decline nationally. So compared to the nation, we've been doing better over this last 10 years. Does that give us does that mean so we have to give up and say, well, we're fine? No, we're still higher in terms of our rate of heart disease than the nation, and we're a little bit lower with stroke, but both are much higher than they need to be. These are largely preventable diseases.